Welcome, everybody. Thank you for joining DentiMax today and this webinar featuring the DentiMax Communicator and how to power your practice with it. I want to start by saying a quick overview. Many of you have either heard of or have used yourself in the past some sort of different patient communication and engagement tool, a system like Solution Reach or DemandForce, Lighthouse 360, so on. There's a lot of them out there these days. There's no longer just one player or one source in the market when it comes to patient engagement and patient communications. And as we all know, communications are key these days. Patients want engagement that is easily accessible, and dental practices everywhere are adapting to more convenient communication systems. Now, the real question is, are you one of them? Patients definitely are looking for quick, easy convenience. I think people in general are wanting those things, especially here in the US. And so this webinar is going to focus on showing you some of the tools that the DentiMax Communicator can offer you in order to provide that level of service to your patients. The DentiMax Communicator is a web tool that was crafted to integrate bidirectionally with DentiMax and provide many functions for your disposal. So it is a website that works and merges and talks back and forth with your DentiMax practice management software. Now, the first question that some of you may be thinking is, why do I need a patient communication tool? Isn't that what my front desk staff is for? Your front desk staff, if you would consider for a moment, this person and all the duties that they need to perform, it could be several people. These days, there's an expectation that you have a social media presence, that you're doing online reviews, that you're sending out promotional emails for whitening or any kind of flyer that you might want to advertise. And that doesn't even cover your staff's day job, which is making appointments, collecting payments, explaining treatment plans, rescheduling and confirming patients' appointments, recall management, and not to even mention insurance. Insurance is a job in and of itself. So all of those things that the front office has to do, we're asking so much from them these days, and they can't be expected to do it all without the proper tools. That brings us to the DentiMax Communicator, and the DentiMax Communicator is going to help generate value for you, your patients, and your front desk staff, especially every step of the way. So some of the ways that we do that is by helping increase your revenue. The DentiMax Communicator has functions to help bring back inactive patients and re-engage them. It has automated promotional campaigns and referral programs to refer a friend easily. It's got 24/7 real-time online scheduling. And that, to me, is huge. So your patients are able to go online and either schedule an appointment directly or request an appointment if you don't want to give them the ability to schedule an appointment themselves. It's going to reduce no-shows for your practice through the reminder system that's in place. And then also it's going to decrease costs for you to allow increased office efficiency. So you'll have fewer phone calls coming in to confirm. We've got here no more confirmation calls. I would say it reduces confirmation calls because there's always a couple of stragglers out there. And practices will save hundreds of dollars annually on postage stamps if you're used to sending out paper postcards to remind people about their appointments or that they're due for hygiene. Those type of postcards, you can use an electronic system instead. We're different because we do offer a two-way texting platform. It used to be that this was the only real-time true two-way texting platform. There are other systems that do offer two-way texting these days, so I don't want to say that we're the only one. The DentiMax Communicator does integrate with DentiMax, and so you'll be able to have a two-way conversation just like you were texting from your cell phone. It also offers automated message settings that adapt to the needs of the office, not the other way around. So you'll see in one of the next slides coming up that we're able to kind of sequence the events on how you want to remind your patients about their appointments and give them opportunities to confirm. Once again, the online scheduler gives the practice full control over how their patients can book online. You can limit the type of appointments that they're allowed to book online and keep it really simple. You can choose which providers they're able to book online with. You can choose which hours or which days they're able to book online appointments for. So all of that is totally within your control with the DentiMax Communicator. It also offers hundreds of customized templates for promotions of all kinds, including now these days, COVID-19 alerts and information. Also, the user interface, which I'll show you here shortly, makes the system really easy to use. The layout is very similar to DentiMax, where you have your windows listed at the top of the screen and then your options on the left-hand side. And also, the system solicits authentic Google and Facebook reviews while filtering out negative reviewers. So it'll pre-screen your patient and send them to either a review site if they give you a great score for that day, or you can set it up where it sends that patient to an internal survey instead if you didn't get a great score and you don't want them to go online and shout out about whatever their issue was. They can talk to you directly about it through that internal survey. And then also we've got our dedicated DentiMax team who is going to help you with the communicator in getting the settings set up from the install process to training on how to use all the various features. This is a slide example of the homepage and the user interface I just wanted to show you. The homepage is like a dashboard. So at the top, you've got home, appointments, patients, communication center, your settings, and your history. And then you can see if you've got any new messages that have come in. It's just a quick place to go to see that data. And then you can see the individual text messages that have been sent or received. And down below, patients who have confirmed their appointments, online appointments, or requests for appointments if you choose that option instead. And then the wait list requests, and I'll go over that here shortly. The left-hand panel just gives you the opportunity to search for a patient real quick if you need to. Just pull someone up and shoot them a quick text message. See today's schedule, look at tomorrow's schedule, and just any statistics about how many people have confirmed and that sort of thing. This is taken right out of my demo system, so I don't have a ton of data to show you in it because it's a fake database, but I wanted to give everyone a snapshot of what the homepage of the Communicator website looks like. The system really lets you set it and forget it for automated confirmations and appointment reminders. So it's very customizable, which I'll show you in the next slide on how you can plug in your different settings. It does have live data sync, so it's not syncing once an hour, it's syncing all the time. It's constantly updating with your practice management data. So if an appointment gets moved or canceled off the schedule, you don't have to worry about the DentiMax Communicator sending another reminder to that patient because it didn't know that that appointment got canceled. It's syncing every few seconds, so it should be up to date in real time. You can send automated day of appointment reminders, which is really great because the patient can get that final notice a couple hours before their appointment, and that has been proven to reduce no-shows by up to 70%. It's also an all-in-one confirmation system. So patients can confirm appointments instantly with just a click or a fast response by saying yes if they'd like, if it's a text message. And they can seamlessly add that appointment to their calendar through of course, their cell phone and mobile apps if they've got their calendar hooked up to that. Or if they're on their desktop using a computer, they can save that appointment to their calendar directly. And when a patient confirms, the communicator will not send that patient a follow-up confirmation message. So a lot of other systems would continue to send another confirmation message, not recognizing that it's been confirmed. Our system will stop and only send the day of reminder if that's how you have it set up. Also, if the patient cannot confirm their appointment, the two-way texting platform enables them to send a request to reschedule their appointment without having to call your office. This is an example, again, from my demo database, Dr. Emmett Brown, and this is just kind of showing how I have my automated messages set up. You can see here that it gives you a nice grid, a nice layout, so you have an understanding of how often your patients are getting reminders. So 2 weeks before the patient's appointment, I have mine set up to send an early reminder. This is not an opportunity for them to confirm their appointment. This is basically replacing that paper postcard as a heads up that they have an upcoming appointment. It gives them a couple weeks advance notice, so they have plenty of time to check their calendar and see if that appointment is still going to work for them or if they need to call and reschedule. The little icons here are showing you I have this early reminder going out via email and via text message. After that reminder, if they're still on the schedule for the same appointment, 5 days before their appointment, they'll get their first confirmation option. So that's the first time that they have the ability to respond and confirm their appointment. I have that going out once again via email and via text. 3 days before the appointment, it'll send the second confirmation if they did not confirm to the first one. That is also going out via email and via text. And then I also have a first confirmation call that's going out, and it's actually an automated phone call to the whatever home number is on file for that patient. And it'll say, "Hi, Alicia, we're just letting you know that you have an appointment on this day at this time. Please press 1 to confirm." So the phone call setting is in there as well. And the important thing to know about all these different types of reminders, phone, text, email, is those can be customized per patient. So if one patient only wants text messages, you can disable the phone call and the email for them. You have a lot of control over what your patients are getting. And then lastly, the same day of the appointment, an hour and a half before the appointment, I have the appointment reminder going out via email and via text once again. All of this, again, is customizable to your practice's preference, but you can see that there's a lot of options to get ahead of scheduling or confirming those appointments to reduce your no-shows. Texting is a must-have. So this is a conversation I've had with a lot of our DentiMax customers. People these days want to text you. According to the International Smartphone Mobility Report, Americans spend 26 minutes per day texting versus only 6 minutes per day talking on the phone. People would simply prefer to shoot off a quick text and get notified of a response when it comes in versus calling the office, waiting on hold, explaining their needs, and then potentially getting passed to different staff members while they wait. This again comes down to convenience, and people really value convenience these days. Patients can initiate a text conversation with your practice by saving your practice text number on file in their cell phone. So instead of calling, they can shoot out a text to you at any time. The conversation enables different staff members to view and manage the discussion. It doesn't just go to one computer or one staff member. This is a website platform, so anywhere that you log in on any computer, you'll be able to use the DentiMax Communicator, even from home. So keep in mind that you can pull that up and have text conversations from home or anywhere you've logged into that Communicator website. Every conversation string is saved and archived in the DentiMax Communicator. So if there's ever any question about what happened in that text conversation, you'll be able to go back and pull that up. Also, you get instant desktop notifications of an incoming message, and you can also set it to ring or do a chime on your computer, so you have that audio notification as well. Recall, of course, is a general dentist survival tool. So I just want to talk about that for a second and how important having a recall system in place is. So dentists retain less than 41% of the new patients who have come to their office. Recall is the key to bringing them back again, of course. Dentists also spend 5 times more money to attract a new patient rather than retain an existing patient. It takes 20 to 40 hours per month to make recall phone calls with a single provider practice. The Communicator automatically sends recall messages to patients who can click on a link in the message to schedule their next appointment online if you give them that ability, or to request an appointment online. The system can continue to send messages intermittently until the patient schedules a recall appointment. So this system is going to help you stay on top of your recall system. If you take a look at this slide, this came out of my demo system as well. And so you can see the automated recall settings that I've got plugged in here. So my patients are going to receive a recall notice 1 month before they're due for recall if they're not scheduled. If they are already scheduled, they're just in that appointment reminder and appointment confirmation sequence that I showed you a little bit ago. If they're not scheduled, this is going to help you get them scheduled. A month in advance, my patients are going to get an email, a text, and a phone call. And again, you can enable or disable any of these in mass or per patient. The date that they're due, if they're still not scheduled, they're also going to get another email, another text, and another phone call. And then if a month passes after their recall due date and they still haven't been scheduled, they're going to get another notice. This is all totally customizable. You can have them emailed or texted every couple of weeks if you'd like. You can do a 3-month reminder. So whatever you feel is going to work best for your patients. I always like to say, if your patients expect a postcard a month in advance, send the email a month in advance. That way the timing, the sequence of things is similar to what they've been used to, except for you're automating the system instead of doing it manually. This next screenshot is basically the flip side of it, and this is working on people who were scheduled and are past due by more than a month for their recall date. So this will help you pull patients back into your practice. You can see on the left-hand side here, there's an option to just plug in a date range of when the patients were due and did not show up or did not have a recall appointment booked. Or you can set a pre-selected option, so 12 months, 15 months, 18, or 24 months past due, and then just search for the patients that fall in that range. Down here at the bottom, these are my patients that are 15 months past due. I would be able to select them and either send out an email, a text message, a phone call, any of the options to try and pull those people back into the practice for retention. A really, really important feature that I mentioned earlier, and arguably the most powerful feature, is the online scheduler. So it's cost-effective and very efficient. Again, your practice has total control over what you allow patients to schedule online, who you allow them to schedule with, and the days and the times that you allow them to schedule for. The online scheduler will save your practice money. 38% of appointments will be made online once you integrate this into your practice. That's a lot of money in savings if you think about it that way. It also frees up your staff's time, so they're not on the phone saying, will this work? Will that work? Will that work? It'll allow the patient to be empowered to just go book an appointment at midnight if that's the time that they're available to try and get with you and make that appointment. So it offers a lot of flexibility. 81% of patients surveyed would prefer to schedule online appointments, including myself. If you think about yourself for a minute and think about having to pick up the phone and call your medical provider or somewhere you need to get an appointment with, you can just go online and book it yourself. It's just so much easier. 45,000 plus providers already offer online scheduling through ZocDoc and other options. This would replace that if you do have ZocDoc or something to that effect. This is an example of what my online scheduling page looks like. You can actually add a button to your website if you'd like, to your Facebook page, to your emails, to basically anywhere you'd like, that will link them over to this scheduling page. This is just the front page. It allows the patient to select the language, and then select one of the options that you set up for them to come in for. For my practice, I have it set up where the patient can schedule a consultation, an existing patient cleaning and exam, or a new patient cleaning and exam. The labels and the titles and the options that you put on here are totally customizable to your preference. In summary, DentiMax Communicator is really providing a superior patient experience over the manual method of doing things. 85% of patients want to receive digital communication from their providers. 81% said that they would schedule their own appointments via a secure web service if they had the ability. 35% reduction of no-show rates with the use of text and email reminders. And keep in mind, for average practices, that's about $40,000 worth of appointments each month for no-shows. And 34% of patients were willing to switch providers if offered an ideal experience elsewhere. I want to leave you with that thought, because if you think about your own buying habits and your own booking habits and the things that are more convenient for you, such as Amazon Prime and grocery delivery and all of those services these days, you will switch from your existing situation, be that driving over to Walmart or the grocery store or wherever you're going, in order to have a delivered experience if you're going to get the same product in your mind and the same setup, the same service. And of course, people don't want to have to call and spend time waiting on hold, so keep that in mind. I also want to wrap up by saying right now we're offering 60 days free on the DentiMax Communicator. And then there's a huge discount. So most products of this type are going for about $300 a month, somewhere between $275 and $300. Our price is about half that. So not only will you get a couple months free, which is super valuable right now, especially with a lot of practices having been closed down due to COVID-19. So it'll help with your cash flow a little bit, but it'll still give you that tool to do mass communications. Let people know that you're open again. Let them know you're ready to help them. Give them convenient tools to book an appointment when they can, instead of having to call and try and get with you when they're trying to get back to their jobs and their daily lives as well. So you definitely want to use a tool to power your practice. Please don't expect your front desk staff to pick up the phone and call every patient to try and get them all rebooked. For more information, of course, give us a call. The number's here on the screen, 1-800-704-8494. Or you can email PM for practice management sales @dentimax.com. And Brittany, myself, the rest of the team will be happy to answer any questions that you might have and give you a little more specific information. If you want to get into the nitty-gritty of things, we're happy to do that with you. You can also go submit a request online if you'd like. It's info.dentimax.com and then /GN346 WJ1EB. Please let us know how we can help you. We wish everybody the best, and please don't hesitate to reach out if you have more questions. Thank you so much for joining us today, and we look forward to talking to you soon.